Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Hello, everybody. Happy Labor Day weekend. This is Living Pain-Free. I am Dr. Thomas Grove. Dr. Marc Darrow is away from this week. Emma, I see you as a caller. Give us 1 second here. Let me give out the phone number. Our number to call us live here in the studio. Talk to us about your musculoskeletal orthopedic needs. We're at 866-870-5752. That's 866-870-5752. We'll give you a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Fantastic book. Lots of great studies, lots of great stories, lots of great education about what regenerative medicine is, right? Using the power of the healing cells of the body, platelets and stem cells, to get some healing going, to rather regenerate that tissue rather than operate on it. It's a different world now in musculoskeletal medicine. Regenerative medicine's making a huge wave in the world of not only sports medicine, but any sort of orthopedic or musculoskeletal issues that people might have. We see a lot of these now elective surgeries. We don't think that they're necessary, 100% of the time. Certainly sometimes you need surgery. Love our surgeons, love how talented they are, love their ability to do amazing things in the operating room. We're a little biased here. We'd rather go conservative rather than going with invasive procedures. So surgery should be the last line of defense for these issues. And again, regenerative medicine is an amazing tool that we can now have at our disposal to help heal that tissue up. Check out our website. Tons of great videos, lots of great studies, great place to educate yourself on this regenerative medicine treatment. We're at www.jointrehab.com. That's www.jointrehab.com. If you're somebody knows that they want to take a peek at this stuff, they want to get a free consultation with our staff over the phone, give us a call. Our number is 800-300-9300. That's 800-300-9300. Emma, thank you for your patience. This is Dr. Thomas Grove. Love to chat with you. Coming to us from La Crescenta, I see. How are you?
Fine. How are you?
I'm doing great. What can I help you with?
Good. Well, I have bilateral arthritis in my knees, and I read your book. A friend of mine gave me your book. It was very informative, and I don't know if I missed it or it's not in there. But how do you decide when somebody comes to see you if they need the PRP or they need the stem cell? How's that determined?
Certainly. Really good question. It really comes down to, what is your timeline? So platelets are really, really good. Platelet-rich plasma, very good at healing tissues. We do see that stem cells typically results in less treatment and a little faster recovery time. Only downside is just costs a little bit more, but typically that's what's going to get you to your goal a little bit faster. So that's a very personal decision. Again, these are elective procedures. You said, which one do you need, right? So no one needs regenerative medicine. We would just invite you to say, hey, this can be something that can potentially heal you a little faster, keep you out of the operating room, and hopefully speed up your recovery time. But yeah, it really comes down to, what are your goals? What's your time frame? And, what sort of budget do you have to work with? And some people need to be back in a couple of weeks, and they're like, hey, man, I'll do anything. I got to get back. My job depends on it. Other people can be a little bit more patient. Maybe they've got a big vacation coming up, things like that. So that's just a personal decision for you. How do you know you have arthritis in your knees, if I might ask? Do you have some imaging done?
X-rays. But the other day, I was complaining to my doctor about a place in my calf that is incredibly tender. And so they had an MRI, but they said they wouldn't take an MRI of the knee because she's not an orthopedic doctor, just my primary doctor. So they did the MRI and found out that knee has a Baker cyst and a complex meniscus tear and arthritis.
Certainly. So again, these are really easy to see structures on the ultrasound. Oh, sorry, go ahead.
The complex meniscus, I read on the internet that can't be surgically fixed.
Yeah, so we can talk briefly about, meniscus tears. So what Emma's referring to is the meniscus of the knee. So we've got a couple different menisci over our body. There's some in the knee. There's one on the inner half and the outer half called the medial and the lateral meniscus. Acts as a couple different things. First, it's a cushion between the thigh bone and the shin bone, right? So it helps kind of cushion the knee. We know that if you trim out that meniscus and you remove it, you very quickly advance somebody's arthritis. We know it plays a role in providing some cushion to the knee. In addition to that, it's an attachment point of some ligaments to the knee. Now, ligaments to the knee provide stability, so it's going to prevent you from having that sort of buckling feeling of the knee. And the way that they're characterized typically is by location and then what the shape of the tear is. So, Emma, you said that you had a complex tear is what they told you?
Yes.
Yep. So again, sounds really big and scary, but complex just means that you've got a tear in multiple directions, right? It could be front to back or side to side, and it's some combination of that, right? And in terms of meniscus injuries in the surgical world, really what you can do is either do no surgery, obviously. That's where they just explore it. They go in and just take a peek with a scope, right? They make small incisions. They go in with a little camera and actually take a look at that meniscus. And sometimes they say, yeah, it looks normal. And then they come out. Again, that's exposing yourself to the anesthesia. A lot of times when you're actually putting those scopes into the knee, a lot of times you're doing damage to that cartilage, not on purpose. It's just you have to put that scope in. And sometimes that can rough up that cartilage, which gives you instant arthritis, right? The other options are doing what we call a meniscectomy. That's where they actually trim out healthy meniscus. Okay, again, to me, makes no sense because we know that meniscus provides structural support, provides a cushion in the knee. And when we take that out, right, we're giving somebody worse arthritis walking out of the operating room, actually limping out of the operating room compared to when they came in. Another option is doing what we call a meniscus repair. That's going to be more in the athletic population. So, if you've got your favorite NFL player who goes down with a meniscus injury and they do a meniscus repair, that means it's typically a really big tear and they can suture or sew down that meniscus onto the bone and hope that it heals. But again, these are things that a lot of times can be treated with regenerative medicine. Okay. So especially if you're walking around in these injuries, there's a very high likelihood that we can get you some relief with that. You mentioned also a Baker cyst. Is that correct?
Yes.
Yeah. So Baker cyst, I see these all the time in the clinic. This is the person who comes in, they've got maybe some knee pain and they feel maybe some fullness. Sometimes they're small, sometimes they're big. I had a gentleman who had a grapefruit-sized one a couple of weeks ago. That was like a little over 100 cc's I drained out of his knee. But this is a potential space, meaning that when the knee joint fills up, so you ever get water in the knee, there's kind of a spillover, a little reservoir called a Baker cyst that can fill up. It's right between one of the calf muscles and one of the hamstring muscles. And when that fills up, we think there's kind of a valve system there, meaning that fluid can get into it, but it can't get out. So a lot of times these Baker cysts will just linger around for long periods of time. And sometimes when they get really big, that can cause things like calf pain, which sounds like what you have going on. So again, the way to tease that out is, again, doing a proper hands-on physical exam and using an ultrasound. Again, in the event that you had a Baker cyst, these are very, very easy to access. But it can be a very dangerous area if you're not using ultrasound when you're draining these pockets of fluid because you've got some major vessels going on in the back of the knee, right? You've got some major nerves going on in the back of the knee that every time I do a Baker cyst aspiration, meaning I'm pulling fluid off of that pocket of fluid, I'm making sure I'm identifying those targets. I've got some mentors. They always said, identify your landmines, making sure that you're not hitting any structures that you don't intend to. So with a Baker cyst very close to the skin, I can find my easiest access point, use a really small needle, actually numb it up even before that. So a lot of times you don't even know that I'm doing it. That's a really, really quick procedure that can give you pretty instant relief. The downside of only draining a Baker cyst, though, is a lot of times you're not treating the underlying issue. So a lot of times you'll have, an internal derangement, something going on inside of the knee that causes that fluid to build up in the first place. So most people, it's arthritis. Other times you can have, strain of a meniscus or a ligament that causes a lot of fluid to build up in the knee. But yeah, this is by far the most common thing that I treat in the clinic is knee pain, right? So it sounds like you got a couple of things going on. Emma would love to see you in the clinic and get some hands on you and see exactly what's going on and see if regenerative medicine is a good fit for you.
Thank you so much. I am going to come see you.
Awesome. Excited to see you. Emma, thank you so much for your call.
Thank you very much.
Have a great Labor Day weekend. But yeah, it brings up a really important point with knee pain. There are so many pain generators for the knee. We can't just assume it's arthritis. Every single week, I've got a patient that comes in. They say, "Hey, doc, I did some imaging," and they say that I have arthritis. And, based on someone's age, I can just look at you and say, yeah, you probably have arthritis statistically. I mean, as we get older, things just kind of start to wear themselves out. But the big question is, what is actually causing your pain? I had a very interesting case this week with somebody who was being told they needed a hip replacement surgery, and they were really young. I can't remember their age. They're like 30 or 40 years old, very young individual to even be thinking about, things like joint replacements. And this is somebody who thought that they needed a joint replacement. They said, man, something's off here. I want to get a second opinion. And brought them in. They did have a little arthritis. Again, I slapped the ultrasound on them. We can see that they have some arthritis, meaning that the joint space gets pretty narrowed down. That cartilage gets worn out. But the issue was when I actually stressed the hip, that wasn't the cause of his pain. And then when you're actually palpating around the hip now, we found that he had an old quadricep tear that didn't quite heal properly. So this is somebody who, thank God they didn't have the surgery, but was, told, hey, listen, you need to have a joint replacement. That's a pretty young age as well. But really their issue was a muscle attachment outside of the joint. And again, how do we find that out? Listening to the patient, right? Putting your hands on the patient, scanning him with the ultrasound. You can see it clear as day where that small little tear was. This is somebody who fortunately got better after one treatment. I just did a follow-up with them this week. This is a very common occurrence that we see. So we always encourage patients, hey, making sure you're taking some pause before you go ahead with a surgery and think about, is this something I can heal naturally, right? If maybe I take a little time off and rest it, if that still doesn't work, maybe regenerative medicine is a real option for you, right? We're just going to jumpstart that healing process using platelets and stem cells. We deliver these cells on target under ultrasound guidance using very small needles to create a little inflammation to jumpstart that healing process. The body lays down some immature tissue, lots of great growth factors, lots of great cell-to-cell communication happening. We know that it actually wakes up our nascent, our sleeping stem cells, and based on that injury signal, which is a lot of cell-to-cell talking, right, we'll deliver these healing factors directly to these areas. That's how we think this stuff works. So pretty amazing, right, at the expense of being sore for a couple of days is the most common side effect that we see. Again, the complication rates are really cut down once you start using ultrasound. Like I said, when you're avoiding the structures that you don't want to hit and you can find a path to the target, of least resistance, we're not worried about, dinging up nerves or dinging up other healthy structures. It's going to be not only painful, but just unnecessary. Making sure we're being very specific where we deliver those cells. It can be an amazing, amazing tool for people. Again, I've injected myself all over my body. I know Dr. Darrow, who started the clinic. He's one of the original pioneers of regenerative medicine. He might be the most injected man on planet Earth. We got to do some studies on this guy, I'm telling you. He's still running around. Had some really interesting stories with his chronic pain that's how he discovered it, right? So lots of amazing ways that we can heal the body just using injections. It's a huge passion of mine. Obviously, I've dedicated my life to it. After you see the side effects of using some of these orthopedic surgeries and you see the benefit of regenerative medicine, you really become a true believer. So would love to help you or a loved one. You can give us a call live here in the studio. You can chat more about any sort of injuries that you or someone you know is going through. The number to call us live, 866-870-5752. That number to call us live here in the studio, 866-870-5752. You can talk to me live right here. We'll give you a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We'll even pay the postage for you on that one. You can give us a call for a free consultation over the phone with our staff if you'd like. That's at 800-300-9300. Again, it's a free consultation over the phone with our staff, not with Dr. Darrow and I, but with our staff. That's 800-300-9300. Making sure to check out our website, www.jointrehab.com. That's www.jointrehab.com. Great way to educate yourself. Check out some videos of us doing these procedures. Check out the research. We're always updating this website too with the latest and greatest of what's coming out. I was actually looking at a study here this morning. I'm very interested in this in terms of what imaging says for people and how often does it really line up with people's symptoms. This was a study that was out of the American Journal of Sports Medicine. Title of this study was Prevalence of Abnormal Hip Findings in Asymptomatic Participants This is a prospective blinded study. So basically what this says is, hey, we've got somebody with hip pain. Let's image them and let's compare it to people who don't have hip pain. And let's image those individuals. So we looked at the people who had no pain and we imaged their hips. And this is a pretty young patient demographic. Average age here was 37.8 years. Healthy volunteers, no history of hip pain whatsoever. They underwent MRI. Pretty amazing. So they found abnormalities in 73% of these hips. So people with no pain coming in, did an MRI, 73%. Pretty interesting. By far the most common thing was going to be labral tears. That was identified in 69% of hips. So again, it's a very common occurrence when someone comes into the clinic and they say, hey doc, I was told I have a labral tear. I need to have surgery on this thing. And I point them towards, studies like this saying, hey, listen, just because you have the tear doesn't necessarily mean this is the cause of your pain. We certainly see people who have no pain. We image them and we see something wrong with them, right? That's why we always talk about, what is the pathology versus the reality? What's the pathology of what's actually going on with the image compared to the actual source of somebody's pain? So very frequent cause for people to get rushed into surgery. It's like, oh man, I have a labral tear. I have to go in and get this surgically fixed. Again, looking at the outcomes of these labral surgeries compared to really doing nothing are very comparable. So we want to make sure that we're doing the safest thing for our patients as we can. If you're going to have surgery, just make sure it's something that you really need to have done, right? Talk about things like complication rates and what is your realistic healing time. We talked to Mark earlier, who described his experience with a rotator cuff surgery that took him a very long time to heal, right? So when you're looking at things like surgery, you do the surgery, right? That's the fast part, right? From there, you probably have to mobilize that area for a bit. And then after that, right, lengthy rehabilitation. 'Cause a lot of times those muscles around that area that was operated on kind of shut down, whether you're not using them or they actually shut down from the surgery. And you have to wake those things back up. You've got to get some strength going back in those areas. And that's a very lengthy process. So it's very common that people, will compare regenerative medicine to surgery. And let's just say all things are equal, all right? Again, complication rates are definitely not equal. A lot more complications rate with surgery compared to regenerative medicine. Let's just say all things are equal. Which one's going to get you there faster, right? I mean, regenerative medicine is a much, much faster way to get you healed. When you're looking at things like, what's your opportunity cost here? What's the time, money, and effort I have to put into, where I'm at now versus where I want to be? And with surgery, you might be kind of tricked into thinking this is going to be something that heals very quickly. But again, the issue is it's a lot of downtime, you get physical therapy. So it might, realistically be a year or more before you're back to, where you think you should be. And again, regenerative medicine is just a much faster way to get you back without that complication risk. So it's a big reason why we're very passionate about this. I want to make sure we're getting you back living the life that you want to live. I had an individual who had something called a frozen shoulder. I don't know if you guys have ever heard of that before. The medical term for that's called adhesive capsulitis. This is where the capsule, which is that piece of tissue that lines the joint, this is particularly in a shoulder, ended up getting very inflamed. And as you can imagine with the name frozen shoulder, the shoulder doesn't want to move. It is frozen, man. It doesn't want to have a whole lot of range of motion. And this is somebody who developed that after a rotator cuff surgery. So, a reason why we think this might be is because if you immobilize, right, or you don't allow that shoulder joint to move after a surgery, you can certainly get things like this, right? And adhesive capsulitis can be a really challenging thing to treat. Most importantly, it's a very long healing process. Anytime that someone comes in with frozen shoulder and they say, hey, listen, I don't want to have surgery and, I don't think regenerative medicine is for me, what's the timeline on this thing? And again, optimistically, it's about a year or more that you're looking at in terms of really aggressive physical therapy to maybe, get that shoulder back to where it was before. So it's a pretty common side effect that we see. Again, it's not like everyone having these surgeries gets frozen shoulder. Again, we're just getting a lot of the cases who obviously had those. And it's we're busy, man. We see a lot of these things. So it's a very real complication risk for people. But we get a lot of frozen shoulders that we actually can speed up that recovery process that we found using regenerative medicine to help. Again, you initially inflame the area, but long term you actually decrease the inflammation, heal that tissue up. So we give them a stretching protocol. We come back for a couple of treatments, and this is something we can speed you up. So even if you're in that boat, it's something we can, give you a good chance to heal with. But again, surgery is just one of those things that, comes with a lot of extra baggage, right? The time frame, the money, time away from work. So it's a very time-intensive commitment to healing compared to what we do with regenerative medicine using platelets and stem cells, right? We take those healing cells of the body, inject them into these areas that we want to get some healing going, decrease inflammation long-term, provide more structural stability to a joint, and give you put you in a position that you can heal without surgery. So let me give that phone number out one more time, guys. We'd love to get you an opportunity to talk with us live in the studio about any sort of musculoskeletal or orthopedic issues that you're having here. Our number to talk to us live, 866-870-5752. That's 866-870-5752. We'll give you a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. You can give us a call for a free consultation over the phone with our staff, not with Dr. Darrow and I, but with our staff. That number to call is 800-300-9300. That's 800-300-9300. Check out our website, educate yourself, get a good opportunity to take a look at what these procedures look like, take a peek at all the research that we have, take a peek at what the research is that's coming out about regenerative medicine. Great place to start and get some good information about what regenerative medicine is and everything that it entails. We're at www.jointrehab.com. That's www.jointrehab.com. Another thing we wanted to talk about here this week, bone-on-bone arthritis. Oh, man, I had a lot of patients yesterday, and that was their chief complaint. They came in and said, hey, I've got bone-on-bone arthritis. I need to have surgery. What am I supposed to do here? And I said, all right, well, if you got bone-on-bone arthritis, right, let me see you walk around, right? Someone said they had it on their knee, another person on their hip, another person on their ankle. And they're taking laps around the clinic. So I am scratching my head thinking, yeah, I don't think you have bone-on-bone arthritis, right? True bone-on-bone arthritis, what is that? That's where the articular cartilage is totally worn out, right? That would mean that joint can't move at all. You think about two bricks, rubbing together. Arthritis is something that is a spectrum. So you can have a little bit or you can have a lot of it. And bone-on-bone is like the end stage, right? So if you're, walking into our clinic, chances are you don't have bone-on-bone arthritis. And they're like, well, how do you know that? How can you prove it? And it's like, okay, well, we can lay you down, put the ultrasound on you, and actually show you, that you have cartilage in these areas. So again, ultrasound's an amazing tool. I'm so fortunate and blessed that I was taught by some amazing minds, amazing hands to get this skill set that we can actually diagnose with ultrasound, right? We're taking a look to see what that tissue looks like in real time. In addition to that, there's other injuries that you got to make sure you're looking out for. Thank you guys so much for tuning in. Have a wonderful Labor Day. Again, let me get an opportunity to get a consultation with our staff over the phone. That's 800-300-9300, 800-300-9300. Check out our website, www.jointrehab.com. That's www.jointrehab.com. Have a safe and healthy Labor Day weekend. Thanks for tuning in, guys. We'll see you next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.